Good morning, everyone. Of course, I would have tech problems signing in. Too many passwords to keep track of. Hi, everybody. Hi there. I'm Angie Fitzpatrick. I am the director of the Catherine S. Eberly Center for Women here at the University of Toledo, and I am just overjoyed that we are all here today. It's a gorgeous day. The sun's out, snow's melting, the birds are chirping, and good things lie ahead, right? So, all right, I need to thank some of the folks who've been involved in putting this together, go over some house rules, and then we will go ahead and jump into the event. So, all right, this is our first ever Gender Equity Summit. We hope that this is the beginning of many more beautiful things. Today wouldn't be possible without the dedication and support of our partners. So we have the Department of Women's and Gender Studies at the University of Toledo, the Toledo Lucas County Public Library Steinem Sisters Collection, United Way of Greater Toledo, YWCA of Northwest Ohio, and Women of Toledo. And I want to give a very special shout out to Wendy from United Way, and to Lisa from YWCA, and to Rebecca from the Steinem Sisters Collection for coming to the table and helping me put this together. And of course, Nina Corder from Women of Toledo. If you know her, you probably love her because she's wonderful. She was also doing a lot on the back end, sending me names of people to reach out to. And she was just super helpful. So glad to call her my friend and my partner in gender equity. All right. Now for the housekeeping. Please keep your mic muted if you're not talking. We're a year into Zoom life, and as you know, if your mic's not muted, we can hear you crunching and doing all sorts of stuff that you probably don't want us to hear. So keep it muted. We have different moderators have different levels of comfort with people asking questions via their mic or chat box. So let's just look to the moderators for guidance on that. You can leave and rejoin the Zoom event throughout the day by clicking the red leave button on the bottom right corner of your screen. When you're in a breakout room for the concurrent sessions and networking, your moderator will let you know when to head back. And again, you can click leave, and that'll get you out of the breakout room and back to the main room. So because of Zoom's technology, we are only able to do closed captioning in this main room. So if you're in a breakout room, you're not going to see the closed captioning that you do here, but we are recording all of the sessions and those will be captioned and we will send them to all registered participants. All right. So if you feel like you're missing something in your breakout session, you can come back to it in the video. All right. And because we're recording, if you're comfortable, we would love for you to be on screen with us. It makes the room feel a little fuller when we can see faces. We also get it though if you're not comfortable being on a recording. So feel free to not show your face, but we would like it if you had your name. If you have some safety concerns, feel free to just use a first name. There will be a break in the day from 12 to 1. Me and my crew, Danielle and Emily, we'll be sitting here eating lunch together on screen. Feel free to join us if you'd like. We also understand if you need to take a break. So, okay, now on to the main event. So the vision for this summit was to bring together amazing women from around the area who are doing the very important work of improving our community for women and girls. Our hope is that today is a launching point for continued conversations, expanded networks, and new initiatives. All right. So this isn't the end, this is the beginning. And we're incredibly happy that Dr. Karen Bjorkman could join us this morning to give the official university welcome for this inaugural Gender Equity Summit. I'm going to say a few words about our esteemed provost. Dr. Karen Bjorkman was named Provost and Executive Vice President for Academic Affairs at the University of Toledo in January 2020, after serving in the role for 1 year on an interim basis. Since December 2020, she had served as Dean of the College of Natural Sciences and Mathematics, and in 2015, she was named as the inaugural holder of the Helen Lutke Brooks Endowed Professorship in Astronomy. And she is also a distinguished university professor. In addition, She is an astronomer and astrophysicist who became fascinated with science and particularly astronomy as a child watching the moon landing. In addition to her research, and I just got a message from her saying that she's having trouble logging on. Danielle,
I'm here. I made it.
Hooray! Okay, thank you. It's good. It's good to have you here. Sorry about tech trouble, right? It always comes up. So, in addition to her research, Dr. Bjorkman has provided significant service to the international astronomical community and has been heavily involved in education and public outreach. She regularly gives public talks on astronomy, space, and science, and she was the original founder of the long-running Universe in the Parks program at the University of Wisconsin. She's a co-founder of the Northwestern Ohio chapter of the Association for Women in Science at Toledo, and her awards include a Cultural Scholar Award, the Sigma's. She has a lot of awards. I'm not going to try to pronounce all of these. So when I got here, she reached out and said, I'm a fan of the Eberly Center. I'd love to meet you, find out what you've got going on so that we can support you. And that is all I needed to know about Dr. Bjorkman. So without further ado, I present to you Dr. Karen Bjorkman, University of Toledo Provost and Executive Vice President for Academic Affairs.
Thank you very much, Angie. Good morning, everyone. I'm on behalf of the University of Toledo. It's my pleasure to welcome you to this Gender Equity Summit. I want to thank Angie, who is the director of our Center for Women, as you know, for organizing this event. It's a pleasure to see the wide range of attendees from both our campus family and also so many of our community partners and organizations. You know, all of you are engaged in important and vital efforts to support and lift up the women of our community and beyond. As an astronomer, a professor, and a woman in the physical sciences, a field in which we are sadly still too rare, I have seen too often the invisible and not so invisible barriers that exist for women. There is a saying that women hold up half the sky. The universe and its contents, including those on our own little planet here, are complicated, and they're complicated to understand and decipher. And I often worry about the impact of losing the great amounts of potential and talent that we throw away when we don't engage and enable such a large percentage of all of our people. Despite the progress that we've made, we still have a long way to go. You know, in the face of this COVID-19 pandemic, even more pressure has been placed on women, whether through caregiving for others or supporting children who are trying to learn from home or trying to juggle the myriad ways in which seemingly everything has been more difficult and more time consuming. We know that women are leaving the workforce in large numbers due to these competing issues. And at universities across the country, women in tenure track positions in particular find themselves falling behind in their research and scholarship progress, which potentially could derail their progress toward tenure. And that's why at the University of Toledo, we've instituted a no questions asked policy of providing a 1-year extension to the tenure clock for all tenure track faculty who request it. No questions asked to try to help with this issue. As the University of Toledo, I like to say we are also the university for Toledo. We value the ongoing relationships and the common goals that we share with our community partners and all of you. And so I look forward in this summit to hearing more about the good work you are all doing, how we can continue to work together to strengthen those partnerships and to benefit all in our community. I want to thank you for taking the time out of your busy days to participate in this event today, and look forward to hearing more about what the things are going on. Thank you, Angie.
All right, thank you, Dr. Bjorkman. So next up, we have a presentation by our friends and partners over in United Way who have been on the front lines this past year. Well, on the front lines for a long time, right? But as Dr. Bjorkman mentioned, this past year has been particularly difficult. We have not only the COVID-19 pandemic, but we've seen, you know, other traumas arise, financial insecurities, increasing racial injustices, community violence. So I'm going to turn the mic over to Wendy to introduce herself and her team and to share her presentation.
Hey, good morning, everyone. This is so much fun. I see a lot of faces I wish I could see in person. And so this is so nice to get together and have this discussion. As Dr. Fitzpatrick mentioned, the inaugural opportunity here to have a discussion about women and girls in our community, and there couldn't be a better time for it. We talk a little bit in our presentation, and then to follow have some more data and things that we would like to discuss as United Way. But again, appreciate the time. I would like to introduce Lucas Camuso-Stahl, who is on our staff. He is our advocacy and policy expert and someone who's really been tracking how the pandemic has impacted women. And it's sort of funny, especially around the issue of childcare. Lucas is a gentleman who doesn't have any children. And I said, did you ever dream you would worry so much about childcare? But he is now just immersed and very interested in how we talk to lawmakers about this and where CARES Act dollars go. And then we've been talking a lot too about elder care and the needs there and how this really impacts women very specifically. Obviously, there are a number of other things when we talk about, a community that has, I think, a number of strains on it, whether it's economic, and then it's Toledo. To me, one of the things I was surprised by, and Lisa works a lot with this, I did not know that this was such a sort of a dangerous community, really, a lot to deal with in the way of violence and crime and that sort of thing, which affects women. So it's across the spectrum. We need to think about women and their access to vital opportunities, healthcare, a good legal representation, safe places, food, you name it, we see it. So looking forward to the discussion today, and please want you to know that United Way is always there to help you. Asha Barnes, want to thank her for being here. Asha serves on our board. She is a healthcare executive, but she has insight into, I think, what it's like to be a woman and trying to, when you start to break out into leadership roles, how sometimes that's very difficult. And this is one smart lady with a fantastic academic background and professional background. And then what her spirit lives in community, where she works with our organization, whether it's with our AALC group, our women's initiative. She serves on our digital strategies board as one of the geniuses who figures out how to make a lot of data analytics work, something that I don't think you see a lot of women of color doing in our country, but it's coming and it's coming fast. So these people are holding the keys to a science that really helps us understand how to move change. So again, thank you for your time today. Looking forward to the conversation on the other side and appreciate our team members. And then one person you'll hear from in this video is I love hearing Libby Schoen's story because she is the mother of 3 children under the age of 5 right now. She's been going through this pandemic, an incredible professional, dedicated to the work and her family. And I think she represents a lot of what we've, I think, loved about this time in a way with our Zoom calls. As I joke all the time, I love watching somebody give a very detailed, thoughtful report with a lot of numbers in it while they tie a bow in someone's hair at the same time. You gotta love it. So anyway, hang in there, ladies. Looking forward, and gentlemen, thank you so much for your time today, and we'll go ahead and get started. Of United Way of Greater. Hi, I'm Wendy Pestrue, President and CEO of United Way of Greater Toledo, and really excited to be with you all today, whether it's virtual or in person. Always important to have these discussions. So we were asked as United Way to really look at some data we have on file, and we have a great deal, and we could never get through all of it, obviously. You all are academics and professionals in your own spaces. So there's a lot about this community you already know, and you know where to find the information if it's a question you have burning in your mind. A couple of things to keep in mind. Here in Toledo, we do suffer from a really high crime rate. Poverty at 25, 26%. The national average is at 13, 14%. And then, of course, a lot of pay equity issues in Ohio, things that really, really hurt our women. The average male in Ohio making what, like $65,000 to $62,000 a year, and the average female is only making about $48,000 to $49,000 a year. And the statistic that's real interesting there is even men who are teachers or men who are nurses make more than women who are teachers or women who are nurses. So at United Way, we go a lot off of ALICE data. and that is asset limited, income constrained employed folks. And Lucas is going to talk a lot about that and the impact that, and those are those folks that don't make a lot, but they are working and trying. We've got to figure out some ways to really give these folks a leg up so that they can buy a house, so that they can go to college and send their children to college and do the things that they all dream of, but they live paycheck to paycheck, and it's very difficult. And I think this is the group to really focus on when we think about our policies and what we do in our worlds to affect change. So for United Way, another interesting sort of data asset that we live with has to do with 211. Now, 211 is a little like I liken it to a Rolodex for those of you who are old school, and then or even just a Google search, but you can imagine how hard it would be if you're trying to find certain things by just Googling. And this was where 211 has community resource advisors that will answer a phone, a text, a chat, and they go through what people are needing. And a lot of folks are really in sort of a tipping point, a crisis point in their life. It's not exactly a 911 moment, but they're in trouble and they need something. So for us, our 211 data, just in the last year, for example, during the pandemic, revealed a few things that are sort of interesting. And again, going to the condition of women in our community. For example, 68% of the calls related to food were from women, especially between the ages of 30 and 60. And when it came to looking for food for children when the school closed, 90% of those folks that called were women. When it comes to shelter, about 60% of our calls come in related to shelter between the ages of 18 and 49 years old was the largest concentration. And most of those ladies were looking for rental assistance. Now, in the mental health space, we had 60% of the calls seeking out mental health services come from women, 60% came from women, and 30% of those were between the ages of 30 and 39. And I thought about those ladies looking for, food to get to their children, if they're looking for rental assistance and trying to create stability in their home. And then also you can imagine that the struggle of being at home with children during the pandemic and that sort of thing. So you can see where the need there was great. Now, also COVID testing. I thought this was interesting too. 65% of the calls that came into 211 related to healthcare needs, and that included COVID testing and COVID vaccination efforts. 75%, whether it was the COVID vaccinations or the testing, came from women. Again, seeking out those critical services during a pandemic. And I imagine on the vaccination front, a lot of these women were looking for the shots for their parents. So we think about that sandwich generation, the folks that are at home making these calls and trying to impact the lives of their children and their parents. So it's a big struggle. And today Lucas is going to speak to this. He has data and information and has really been paying attention to how we advocate for women, and especially the impact that the child care closures and the school closures had on women in our community. And then Libby's going to speak to, and just love Libby's conversation about what it's like to be working through this space, having 3 children under the age of 5. And then we'll hear from Asha Barnes, a professional here in town, an amazing person who's very involved with United Way and sits on our board, but her perspective from healthcare and what it's like to be a healthcare executive in this environment, in our community. And then we'll all talk a little bit about ways that we can go forward, and looking forward to the end of this conversation and how we can all work together. So thank you for your time. Looking forward to learning more today, and our partners who will certainly touch on all of these subjects. So thank you again, and we'll get going. So Lucas, let's go kick it over to you and get some more information. Thank you.
Hello and good morning, everyone. My name is Lucas Canuso-Stahl, Senior Director of Public Relations and Advocacy for United Way of Greater Toledo. Over the last year, in the health and human services space, as well as every sector across our community, we have witnessed some of the most devastating social, emotional, and financial circumstances that individuals, children, and families have ever endured in our country's history. More specifically, this pandemic has led to an anomaly that economists have dubbed a she-cession, which is displaying how women, and more specifically women of color, are overwhelmingly absorbing the impact of our nation's economic fallout. The National Women's Law Center shows that in December of 2020, 27,000 women entered the labor force. That is after 863,000 women exited 3 months prior in September. Additionally, in December, 154,000 Black women left the labor force, marking the largest 1-month drop in their labor force size since March and April of 2020. In total, there are nearly 2.1 million fewer women in the U.S. labor force in December than there was in February before the pandemic started. So why is this? Sharice Jones, a USA Today business reporter, says that, quote, this pandemic has really shown us the disparities we have in our culture, end quote. Some of the businesses hit hardest by the pandemic are retail, hospitality, childcare centers, all fields dominated by women. Additionally, surveys have shown us that working mothers are more likely to supervise their children's remote learning and are more likely to care for their young children because of closed or reduced classroom sizes at early childcare centers. What these external pressures led to was a reduction of hours or a complete removal of oneself from the workforce to absorb those family duties. This is, again, especially detrimental for working mothers who, more often than not, can't work their professions remotely. This leads to working moms having to make these unfair decisions and choosing between their livelihoods and caring for their children. Now, to look at this from a historical perspective, United Way's ALICE report, which stands for Asset Limited, Income Constrained, Employed, shows us the already existing financial uncertainty of women and working mothers in our community. Firstly, ALICE takes into account both individuals living in poverty as well as those who exist right above that poverty threshold. For example, ALICE is someone or a family unit who is one disaster away from going into poverty. We oftentimes overlook this particular demographic because in America, we still struggle to understand that overwhelmingly, those who are in poverty or are on the brink of poverty work multiple jobs. If you look at Lucas County ALICE data, single female-headed households account for 7,243 families living in poverty, while an additional 5,304 families of female-headed households were asset limited. Compare that to male-headed households, which account for 1,594 families living in poverty, while an additional 2,619 families of single male-headed households were asset limited. That's a difference of 5,649 female-headed households in comparison to their male counterparts who are in poverty alone. This is knowing that across the state of Ohio, 3.2 million jobs pay $20 an hour, with a majority of those jobs being $10 to $15 an hour. Many women make just 82 cents on the dollar of their white male counterparts. Black women, it's about 63 cents, while Latinx women, it's roughly 50 cents. So when we look at the state of pay, that means affordability for essential resources like childcare, which could allow working women to continue their careers, is just out of reach. And childcare is indeed a leading issue, often an overlooked one, in women being able to continue their careers or return to the workforce altogether. In a report from the Washington Post, economic correspondents have dubbed the country's financial downturn the most unequal in modern US history, with mothers of children ages 6 to 12 experiencing steeper unemployment levels than fathers of children in that same age group. In an analysis of Census Bureau data, the number of women who cited children, childcare, or family responsibilities as a reason for leaving the workforce increased 178%, while the number of men citing it less than doubled. So I'll leave you with this. In analyzing our policies within government or business structures, we need to look at how action around subsidized or stipend childcare could help our communities continue to flourish, especially for working mothers. After all, women's labor contributes $7.6 trillion to the nation's GDP each year. Think of this, in Ohio, if all women took one collective singular day off work, our state would lose $732 million in state GDP. But let's not just make this about money and understand that the lived experiences of women and working moms, the expertise of working moms, the intrinsic value that working moms bring to the corporate table or factory floor is not expendable and is a necessary part in the process of us moving forward as a country. Thank you. I appreciate everyone's time and attention.
My name is Libby, and I work at the United Way of Greater Toledo in the Community Impact Department. I've worked for United Way for the past almost 8 years. I am also the proud mom of 3 wonderful children under the age of 4. I am grateful to work for an organization that supports and understands the need for access to affordable, high-quality childcare. I do this work for my children to ensure that their future is better for the work that I have done. Ohio is one of 28 states where the cost of child care equals that of college tuition, which can be upward of $10,000 a year. Childcare is one of the first things that a family will cut from their budget when circumstances change, jobs are lost, and resources are scarce. Women should be able to work without worry. To expand more on the she session that Lucas had mentioned previously, women on average have an extra 3 hours of domestic housework a day on top of their already full workday and their schedules. Forbes notes that a she session would not only undo the strides made towards gender diversity in recent years, but would jeopardize future progress as well. The most recent Women in the Workplace report found that for the first time ever, 1 out of 4 women was considering stepping out of the workplace or downshifting their careers. Their study of over 40,000 women concluded that if every woman who is considering quitting her job did so or reduced her workload, nearly 2 million women would exit the US workforce. Women in senior roles, working moms, and women of color were most at risk based on this study. Candidly, I was one of those moms. I was one of the 1 in 4. At the beginning of the pandemic, being locked in my house with 3 children under the age of 4, I didn't know how I was going to survive. The lines between work and home were blurred. I would look at my walls and they were full of crayons and marker, and I didn't honestly, candidly know how we would make it. Fortunately, our circumstances changed, and I'm now able to laugh when I see those marks on my wall, and I can try to balance as much as I can. And I'm not tempted to respond to that email at the end of the workday because it'll be there in the morning. I am so grateful for the women and the working moms that have shared their stories. I'm grateful for their support. I'm grateful for them being vulnerable and sharing the wins and celebrating each other. If I didn't have them, I would have been one of the 4. What it all comes down to is we are doing the best that we can to survive this storm with as much humor and brevity as we know how to do. I am hoping that I can create change for my children so that they are not having the same challenges and the same conversations that we are today. I challenge each one of you as we move out of the pandemic and we look forward to be that person that supports your fellow working mom, your sister, your friend, or your peer, and be that hand that really supports them and letting them know that they can do it and they can balance it all, and that some days are better than others, and that at the end of the day, it's just showing up that matters.
My name is Asha Barnes, and I'm the chair of the Data Strategy and Data Analytics Committee of United Way. I also have the honor of serving on the United Way board, and for my day job, I'm the director of market analytics. As a healthcare professional for 26 years, I believe in letting analytics tell the story. There is a very powerful story to be told about the inequality for women to be promoted in the healthcare industry. Healthcare impacts everyone, from birth until death, and has been in the forefront of the news since the pandemic. In April of 2020, it was reported that close to 70% of the healthcare workforce are women, with the majority of them serving as nurses. That number jumps to 89% of registered nurses are women. However, if you compare the executives at healthcare organizations, the majority are run by white males. According to the Bureau of Labor Statistics, fewer than 20% of females hold key leadership roles. Only 19% of hospitals and 4% of healthcare companies are led by women. Statistically, if everyone in healthcare is given a fair and impartial opportunity to advance, the employee in population would reflect similarly from top to bottom. Imagine the difference in patient care if the nurses who provide hands-on care were given the opportunity to rise to position of leadership, making policy. We would see a vastly different perspective to patient care. We need diversity, if not only physical appearance, but of life experiences to broaden, protect, and care for the most vulnerable. When confronting inequality for women, do the analysis to have quantitative proof of the inequity. Every HR department has the simple demographics on each employee. The numbers tell a story that can't be refuted with cliches such as, we hire the best candidate, or women aren't designed to be leaders, or no man would listen to a woman if she were put in charge. I'm here to say keep fighting until we see more women in power and the numbers change. Thank you for this opportunity to share my perspective on fighting inequality with data.
So big thanks to Libby, Lucas, and Asha. Really appreciate your time and insight. And you know, today, all of us are very privileged if we get to be a part of this discussion. It means that we're probably fairly well educated, have some financial stability in our lives. So it's incumbent on us to do something with this, to take this information, this conversation, and this collection of good leaders to make an impact in our community, and especially the women in front of us. You know, the pandemic has been interesting in that it's been a great revealer and accelerator in a way. It's revealed where a number of disparities lie in our community, and it's accelerated the distance between those who live in very vulnerable populations and those who don't. We have to remember that, and we have to leverage what we learn from that and try to create repair. We also need to leverage the fact that professions that were mostly dominated by women, teaching and education and nursing, have saved the day. They have had the biggest impact on our lives, and we're starting to appreciate what women really mean professionally and personally in a way that it's never looked before. We're hearing that a lot from local CEOs. So let's work together. Let's look at our call to action today. So first and foremost, we need to go out there and have some conversations, I think especially with men. Take good data with you and use that to leverage your position, but do it with kindness, do it with an opportunity to learn from them and to share and to try to find that we're not so far apart on how to find a way for women to be better situated in the workplace with their health care, their child care, their pay structure, the policies that impact women when they're applying for roles, really looking critically at that and how we can do that in our workplace, and be very introspective about yourself and how you treat women in these positions and how we can be better to each other. I know at United Way, we'd love to work with the Eberly Center and all the presenters today around data sharing and then the advocacy space. Lucas does a tremendous amount of work there. Our volunteers do a lot of work there. Please join us in this ambitious place where we try to really, really make women's lives better. And we can do that if we work collectively and thoughtfully, if we work with our leaders, if we work with our CEOs here in town. I think that there's an opportunity to take today and make the most of it. And a year from now to look back and say, you know, we had some discovery in this and we found some ways to make an impact. And we just keep moving through that, checking in with each other and long-term conversation around this. There was never a better time to do it. Leverage what's been bad and try to make it good, because we can do that here in Toledo. So thank you for your time. Thank you to all the presenters. Please feel free to reach out anytime, and we're with you. We love you, and looking forward to what the future holds when we work together. So thanks again. Take care.
That was fantastic, Wendy. Thank you so much. We have a little bit of time. Would you like to handle some Q&A right now? All right, well, I'll let you keep rolling.
And there's a point that I want to stress, because we talked a lot about childcare, and obviously we were really struck from the ALICE data how, you know, the impact of childcare along with other issues, you know, affects somebody's economic space. And then I really want to talk about elder care too. I think that in the long run, that's something that we need to focus on as well. It's so easy to forget, I think, generationally how folks are affected, but you know, the average woman in our country can spend as many as about 13 hours a week caring for parents and that sort of thing. Men spend about less than half that time. And more recently, as we work through the pandemic, spending a lot of time with the Area Office on Aging and all of the outreach they're doing and the support and the great work, we're just finding, you know, especially even just getting the vaccinations, it has been it's been tough for folks, and you know, the access to technology and some things, you know, being tough, then you just work your way out from there. But I think focusing on how, you know, our workplaces really address the issues of childcare, elder care, along with pay equity and a lot of other things we recognize as being essential. I think too, one thing to celebrate in Toledo that we were excited about, June 25th, 2020, and I think, you know, with all that was going on, I didn't realize maybe, but a Pay Equity Act was passed in Toledo earlier in the year. It was enacted in June. And one of the things about this pay equity discussion, it really has to do with whether or not employers, you know, can require you to reveal your previous salaries, that sort of thing. And you get a lot of coaching as women about how to approach the job environment, to apply over your head, and use a deeper voice and look them in the eye and all that kind of thing. But even when just the questionnaire says, what did you make? What are you making? That sort of thing. I think we try to follow rules and realize that that's not a rule anymore. You don't have to do that in the city of Toledo, that you don't have to disclose this information. It's not appropriate or fair, and it puts people in a box that isn't, it's not creating a basis of equity and pay. So things like that are progressing in Toledo. I think hats off to the University of Toledo for having the fifth best law school in the country for women. You look at things like that and say, good for Toledo. We can find a zillion other ways to address this. And one of the ways United Way is sort of uniquely positioned is over the year, we spend a lot of time with a number of CEO partners in town as we go through our campaign. And with this discussion this last year, we've really presented as how they saw women being impacted at work, especially. And it was interesting to see gentlemen of a certain age and a certain power structure in multinational organizations saying, hey, I've got great executives I'm losing because they do have to take care of children and parents. And that was a real wake-up call for them. So I think from our position, we're like, here's the challenge to all of us today, not to fall in love with the problem, but to be really proactive. Let's look at structurally some things we can do. We look at CARES Act dollars, how those are invested specifically, ask our lawmakers about that. And again, going to the spaces of elder and child care specifically and the policies around that, but then other investments that really advance what has been lost for women in our community. So just want to start with that, but any questions? And I do thankfully have Lucas and Asha here as backup because they are also great experts in our organization around the data analytics and how we can use this in discussion.
Well, excellent. So why don't we go ahead then and move into the greater panel discussion. We have a number of fantastic speakers from around the city here, and the fantastic Rhonda Sewell is going to be our moderator. I'm going to take a minute to introduce Rhonda, and then I'll kick it over to her. So Rhonda is the manager of external and governmental affairs for the Toledo Lucas County Public Library, where she's a member of the executive leadership team. She's worked in the county system for 15 years, but prior to that, she worked in library advocacy and transformational leadership and was in media relations and marketing. She's been an adjunct instructor at the university, and she spent 18 years as an award-winning newspaper journalist. She holds leadership positions around the cities, very actively involved. She's currently the president-elect of the Arts Commission of Greater Toledo and has served on numerous high-level area boards, including serving as chair of the former ProMedica Toledo Children's Hospital Foundation Board. She's also very active with the Girl Scouts of Western Ohio. She's been a Woman of Distinction honoree and was awarded the Milestones, a Tribute to Women Award by YWCA Northwest Ohio. So in addition to these many accolades throughout her career of service, Rhonda is honored and proud to be the mother of twin adult daughters, Sarah and Savannah, age 20, and they're both juniors in higher ed at the Ohio State University and Ohio Wesleyan University. So Rhonda, let me see, there you are. All right, why don't you go ahead and take it away?
Thank you, Angie. Can you hear me okay? All right, fantastic. I am so honored to be here today with all of these amazing women. And I really want to just say happy Women's History Month. Today is March 1st. And Angie and your collaborative team and organizing team, this is really a groundbreaking summit. So hats off to you and your team for even having the idea and the vision of presenting such an amazing presentation for us today. I also want to, before I introduce the panel, want to really just give a United Way hug. I am a leadership donor of United Way and very active, but I want to give a hug to Wendy and Lucas and Libby and Asha. Their presentation gave me chills. It took me back over 25 years ago when I had the pleasure of traveling with Zonta International to the United Nations Fourth World Conference on Women in Beijing, China. And some of the very statistics that they shared with all of us today are still plaguing women, not only in our own community, but globally. The stats that you shared today are amazing. Thank you for putting all of that detail together. And I just wanted to say that, and I'll get off my soapbox now, Angie, and take over my moderating hat. We have some dynamic women on our panel today. Many of them are, I can call friends, sister friends. They are role models in the community. They are women that I admire, and some of them I have looked up to mostly all of my life. So without further ado, I get to introduce the wonderful Erin Baker. Erin serves as chair of the City of Toledo Human Relations Commission. We call it HRC for short. They endeavor to support a safe, energetic, and livable city. HRC also supports residents working to overcome prejudice and build mutual respect through its free mediation program and the work of its 4 committees focusing on community and neighborhoods, social justice, stop the violence and youth empowerment, and engagement. In addition to HRC, Erin is the organizational learning coordinator for the Toledo Lucas County Public Library, where she leads system-wide leadership development, as well as diversity, equity, inclusion, and access initiatives, one of which she is about to launch called The Big Idea here at the library. I am so honored to work with Erin on a daily basis, and this is a true statement. Erin and I see more of each other in the community than we do here at work. So, and we are usually here. We telework a couple of days, but we are usually here. So thank you, Erin, for being with us. Next, a woman I've admired for a very, very long time, Deb Flores. She is born and raised in Toledo, Ohio to migrant farm workers. Deb is a proud graduate of the University of Toledo. She earned her Bachelor's of Social Work in 1990 and a Master's of Public Administration in 97. Deb was named CEO of the Zepf Center in 2017, and prior to that, she served in numerous roles in the community, behavioral health and services, and student programs and outreach. She is an award-winning leader and lifelong resident of Toledo, where she and her husband, Doni, raised 6 children and are now proud grandparents. And I want to know what she eats for breakfast every day, the cold cream she's using. I want to know all of that because I cannot believe that you are a grandmother. Thank you so much, Deb, for being with us. Next is a woman we all admire, Lisa McDuffie. Lisa is the president and CEO of the YWCA of Northwest Ohio, and she's been a part of the agency for 25 years. Mrs. McDuffie oversees a $5 million budget, 20 county service area and staff strength of near 100 employees. Mrs. McDuffie has a master's in science and social administration from Case Western Reserve University and a bachelor's degree in social work from Findlay College. And she's a licensed independent social worker with supervision status by the state of Ohio. And as we mentioned earlier about the Milestones, a Tribute to Women award, Lisa McDuffie and her team do such a wonderful job uplifting women, well-deserved women in the city of Toledo. Next, another role model, Doni Miller. Doni was born in Louisville, Mississippi. Ms. Miller has more than 25 years of experience in the healthcare profession, serving most of her time as a senior administrator at university medical hospitals and community health centers. Presently, Ms. Miller serves as the Chief Executive Officer of the Neighborhood Health Association, or NHA, one of the largest community health center systems in Northwest Ohio. The system operates 16 federally certified medical and dental clinics and 2 senior centers in Lucas County. Thank you also for being here. Our panelist, Reem Subei. Reem is an attorney with Advocates for Basic Legal Equality, or what we call ABLE. Her work includes eviction defense, fair housing access, jail conditions, equity and education, as well as economic development. Reem has filed and defended cases in federal and state courts, including the United States Court of Appeals for the 6th District, the United States Department of Housing and Urban Development, the United States Department of Justice, and the United States Office for Civil Rights. Let's give a virtual applause to all of our panelists for being here today. We are so honored to have you all. Thank you for holding up the universe for us. Those bios were quite impressive. But leaning on the wonderful presentation by United Way, I want to really jump right into some questions here for the panel. And please, everyone, if you can mute and then unmute if you would like to speak. I will call on certain panelists if there are specifics, but this is one that is open-ended and anyone can really jump right in. If you have questions, please type them in the chat. I think that is a really great way to look at some of the questions and prioritize them and make sure that every question gets answered if we have time to do so. So from the United Way presentation, we heard a lot about the devastating impact of the pandemic on our women and girls. And oftentimes we call these impacts disparities, but it really was trauma experienced by women and girls. And not only the pandemic, but there was the racial strife, the social injustices that we saw, and the political divisiveness that was rampant from last year and into this year. So as women who are leaders in our community, can you tell me how these multiple traumas that I mentioned are impacting women and girls in Toledo and surrounding areas? And is there anything being done about that?
Rhonda,
Go ahead.
I guess I'll be the first to jump in if that's okay. First of all, thank you, Angie and team and everyone for allowing me the opportunity to be here. I'm more than moved to be on a panel with such distinguished community leaders. But the whole issue of trauma-informed care is something that the YWCA, along with many other social service agencies, are more and more familiar with. It is a part of really how we base our delivery of services to women and children that come into our facility. But if I just make a comment on a broader scale, you know, we all know that the combination of all the things that we heard about from the United Way presentation really leads to individuals having difficulty with day-to-day activities. And it's not, you know, waking up in the morning and putting one foot in front of the other, but it's a combination of really the plague of what many women of color face day in and day out. You know, this concept is called weathering. It is a term and an issue that has been in the media and in articles more and more and more, but it's the combination of all of the acts, unfortunately, that happen to sit on the shoulders of women. So if we start thinking about situations in the criminal justice world and even how women and girls are starting to even tip the scale from that perspective in terms of racial profiling and the criminality of women. We start thinking about education and even young girls being suspended and expelled at higher rates. We could talk about the workforce and, you know, all the traumas that come with trying to be a part of a workplace that does not necessarily allow us to belong and feel like we are very much a part of the fabric of the organization. All of those things rest in, unfortunately, the minds and the hearts of women, and it plagues out in many ways in terms of disease, in terms of the stresses of mortality health. And, you know, we see it even with our children in terms of high rates of infant mortality. And so just to get to the end of the question, in terms of what's being done, I think the more we educate ourselves on the importance of understanding there is the difference in how all of those themes together affect women and girls. And, you know, we can talk about people of color in generalities, but if we talk gender specific, it is not a good situation for Black women and girls. We must, one, identify and understand what it is in order to be able to treat it. But I'll also flip that over and say for women of color, it is also something that we must be aware of. We must, you know, let down that whole taboo of counseling and being able to seek services. So I'll pause. I could talk all day, but there's plenty of other voices.
Yeah, if I could join in, Lisa's, thank you so much for those comments. And I agree with Lisa. I'm so flattered to be here this morning. This is the topic. Anything related to women is something that I could talk about for days and days and days. I would like, though, to go back to something Lisa said about weathering. It's a particularly important issue to talk about because at its essence, it speaks to the wearing down of your soul, the wearing down of your spirit, from carrying the burdens of progressive and insidious and constant racism. That's really important for us to think about, especially when we're talking about women of color. It is no secret that women of color suffer horrendously higher rates of all kinds of illness. Breast cancer that we get at the same rate as our white sisters, but we die more often as Black women. We do, as I know Rhonda has heard me say before, women do carry the universe on our shoulders. And we really need to understand, though, the power that brings us to engender change. So all of these things that we suffer day after day after day, and certainly, Rhonda, your question as to the impact of the pandemic on women is holds true. It holds true that for women of color, the implications to us have been greater. The implications to our family have been greater. The severity of the illness, the number of deaths, all of those things have been greater for women of color. However, what we don't do as women, my opinion only, please don't send me hate mail. What we don't do as women is recognize the power that we bring when we speak together, and that when we support each other, and when we have our own tables. I am so tired of hearing conversation that says that we need to be at the table. You know, damn it, we need to make our own tables. Why don't we have our own tables? We are not always nice to each other as women. And let me tell you how the boys did it. For any man on this phone, this is not personal, this is just fact. The way that the guys do it is they pull each other along. They get over the nonsense. They find opportunities, they reach out to their buddies to fill those opportunities. We don't do that well. And it's about time that we started realizing that all of the conversations about the things that impact us would be mitigated significantly if we walked the talk. And walking the talk is meaning what you say about supporting your sisters, your Black sisters, your white sisters, your brown sisters, your poor sisters, your Muslim sisters. It goes on. If we are truly committed to addressing the issues of women, we need to start with ourselves. And, you know, I'm an old-fashioned Black feminist. I'm a 1970s Black feminist. I don't apologize for it. I don't really explain it all that much. I just say that if we really want to get better, then we need to start walking the talk. And all of those things, Rhonda, that you talked about would impact us a whole lot less if we did that. I'm off my soapbox now.
Listen here, listen. I am dropping the virtual mic right now, Doni Miller. So well said. I don't know what view you have, if you have the speaker view or the gallery view, but women are nodding their head, they're fist pumping, they're saying amen, they're putting emojis all over the place, typing in the chat. You really laid it down, Doni. Thank you so very much for those words and for being unapologetic. And I never say old fashioned. We do not say that, Doni. We say seasoned,
Okay.
a seasoned feminist from the 1970s. But thank you for those eloquent words, and really also Lisa McDuffie touched on that intersection of race and sex, and we'll get into that. I want Reem to jump in because she said, I have something to say about this. So Reem, please.
Thank you so much. And now I have to go after Doni, which is like so difficult. But I'm really grateful and inspired to be part of this diverse panel and this group that wants to take a serious look at how we can all help each other. Many of you have such a broad spectrum of experiences. My experience is a little more limited. I do housing law. And when I think about the inequities and the difficulties that came down upon women and upon all of us, especially women, and then especially Black women, during the pandemic, I think of housing and the looming housing crisis. When the CDC eviction moratorium, which is very imperfect, comes to an expiration, there's a looming eviction crisis, which we know is going to fall so heavily on the shoulders of Black women. Even before 2020, Black women were being evicted at twice the rate of white people. And so we can't imagine what's going to happen when the eviction moratorium expires and there is not any even nearly enough money that was dispersed from the government for people to be able to pay their rent when they're losing their jobs and they're having to stay home to take care of children who can't go to school, and so on and so forth. And there's something that I want to comment on that Doni said, because Doni is so fabulous, which is this false concept of scarcity that leads a lot of women to not be there for each other. Part of that is triggered by living in a somewhat smaller city, which is where we live in Toledo. So we have this false agenda that was sold to us that we have to race to be the woman at the table, to be the ones who start that table. Meanwhile, in reality, as Doni very pointedly said, we can build a table and build one that fits all of us. But it's going to be not easy for us to fight this false concept that was sold to us that's like, if you want to be there, then you have to be the only one there. You can't bring all the other women with you. You can't all be there. We just have to choose one person. So if we can, and if we do take this very seriously, we must demand that more opportunities be made available so that women don't have to choose between themselves and the next woman in line.
Wow, Reem, the false concept of scarcity, that will be the hashtag. Wow, Reem, thank you so much. Erin and Deb, please jump right in here.
I just, again, am so humbled to have been selected to be a part of this panel with amazing leaders. I can't even believe I was selected, but I'm so happy to be here and just give voice to what everyone has said, the importance of us linking arms together, because let's face it, the burden that sits on the shoulders of women and girls existed long before the pandemic. It just has exacerbated it. It's had such an incredible impact on women and girls' mental health and well-being. And I know coming from the Human Relations Commission, HRC's perspective, we want to destigmatize the notion of getting help and providing the resources to equip people in our community to be better and do better. In the pandemic, we've seen absolutely the city's women and girls are suffering from anxiety, depression, PTSD, and extremely higher incidences of violence and abuse. And so what we've been doing lately is we at HRC made the decision to partner with the Lucas County Health Department, specifically the Office of Minority Health, because again, as we know, women of color, girls of color are facing these issues even more so right now. And we just have begun our two-part series specifically talking about trauma and triggers because we want to equip our community members with the tools to get better, to get healthier. So I just want everyone to do everything that we possibly can because we are not alone. We feel very isolated right now, but we have got to ask for help. And we have amazing local experts that can provide that help. And that's all the way from youth to adults, because recognize our girls are feeling extra isolated right now without being able to socialize in the aspect of being in schools and in libraries, because of course I'm going to promote the library because so much of that support happens there in those spaces too. And so again, in addition to our virtual series, what we're also doing is providing guardians and youth with all of the necessary resources to be able to get local counseling services, but most importantly, that are affordable for them, that meet their standards of healthcare as well. So again, we are not alone. And I think that's the biggest thing that we're going to take away here today about this topic is we have to work together to support one another and to destigmatize the notion of getting counseling services, social services, therapy. We need it now more than ever.
Thank you so much, Erin. Deb?
Well, good morning, everyone. I will try to bring us home on this question. And I think my sisters on the Zoom call today gave a lot of the information from the national level, what's happening within our community. And I want to talk a little bit about being the CEO of a nonprofit organization and my ability to make change and influence things for women in a positive manner, because guess what? I don't work for politicians anymore. I don't work for the University of Toledo, the big bureaucracy. I have a board of directors that supports me, but I was able through the pandemic to make change that helped the women that work for us. And so some of the things that we found is that our workforce needed flexibility. And I was able to say, be flexible. Except for our inpatient nurses, we were able to figure out flexibility. Whether, prior to the pandemic, if I would have asked someone to work till 8 o'clock at night, they would have had a union boycott. But because of the pandemic, people were able to do their jobs. If they needed to work in the morning with their kids online, they could catch their patients later in the afternoon. And face it, people aren't sick Monday through Friday, 8:30 to 4:30. They have evening crisis, they have weekend issues. And they said, could we work on the weekends to meet our hours? Absolutely. The other thing that we did is we advanced everyone their leave time. We said, you can use your leave time in advance if you haven't earned it yet. A lot of our workforce doesn't have the seniority and the, tons of hours. I lose vacation time because I don't do enough self-care and take time off. So we said, guess what? You can take your time in advance. There were only, if I think about it, maybe one person who left and we didn't get the 16 hours back from them out of all the 500 employees that we have. The other thing that we looked at is open conversation with our staff. And it's not always easy because you can't always do everything they want you to do, but you've got to listen. Some of the conversations are hard, and just acknowledging it. We brought in employee assistants to help support our staff through the trauma. Lisa talked about trauma-informed. Our organization is in year 2 of becoming a trauma-informed organization, which means we want to know what happened to someone. We don't want to say what's wrong with you. And really how we develop policies and have a nonviolence policy in the workplace and other commitments to teamwork and those type of things. So we were able to have open conversation and really hear that, guess what? We're not doing as great as we thought we were. And self-reflection is okay. it's okay to say, you know what, we really do stink at that. So let's improve it. And throughout Black History Month, the staff felt very supported. They felt like they had a say. They feel like it's an ongoing conversation and an ongoing effort. It's not just, someone said it's very deliberate the way we're working now. It's not just onesie, twosie things here, and that we are supporting our staff. If they had any kind of issue, our human resource department worked with them. I don't think we had anybody of the 500 walk out of this organization that said, I wasn't supported, I wasn't able to take care of my kids or family commitment. You know, a lot of them get better jobs. That's the good thing. There's a lot of demand for people in behavioral health and healthcare. So when people leave, it's usually somebody can pay better than a nonprofit. But we had to do a lot of reflection. I did as a CEO and a leader. I said, you know, I'm at the point like Doni just said, I've worked in this community almost 40 years and I'm not going to apologize either. We're going to do the right thing for people and we're going to carry out our mission, which is creating hope and recovery. We partner with Lisa right now. We have telehealth in the battered women's shelter so that if women want access to support, we have resiliency coaches, people that have lived experience. We are tearing apart stigma and making access to care out there in the community. Again, people we can't sit in an office and expect people are going to come to us Monday through Friday, 8:30 to 4:30. So those are just a few things that we did. We looked at our hiring policies and practices. We hired the first African-American nurse practitioner. She was driving to Detroit because no one in this community would hire her because she didn't have experience. And we said, no, and she worked. She was an LPN, became an RN, and now she's at the highest level as a nurse practitioner in our organization. And just looking at every policy, purchasing policies, are we doing things fair and equitable? You know, are we giving people opportunities? And so I can do that. I can say, this is what we're going to do because I am the leader of the organization and we should be reflective of who we serve. So that's my 2 cents for this morning.
Wow. Deb, thank you so much. Way more than 2 cents for sure. I am ready to get out my tool belt, my hammer, my nails, and build that daggone table. So thank you so much, Deb. Thank you to all the panelists. Deb, you touched on leadership. So I want to move to our second question here. So often we talk about women and opportunity, and over the last few years, we've seen increasing coverage of the systemic and widespread barriers affecting women in movements like #MeToo, like #Time's Up, #Black Lives Matter. And specifically, I want to know how you as panelists balance individual actions around leadership and power versus pushing for systemic changes. And some of you in your organizations or your affiliations, that's part of your mission. But I want to know for women who are attendees here today, how that can be done. And also, I'll repeat that. How can you balance individual actions around leadership and power versus pushing for systemic change? Lisa, you want to try to tackle this one?
Sure. You know, the first thing that came to my mind, Rhonda, is, and I'm sure most people are aware that the YWCA is a 501c3. And so regardless of where I sit as an individual, it is difficult to straddle a fence in terms of what my individual views may be, and when that voice speaks versus when I need to have on the hat of the YWCA. What is really fortunate for me, and it appears as though I'm not alone listening to some of the other panelists, is after a point in time, you get tired of being tired. And I am so very happy that I have a board that empowers me to speak collectively in terms of who I am as an individual and represent the YWCA. So in probably the last 6 or 7 years, you have heard me speak quite boldly and courageously on really the ill effects of how society treats women and people of color. And that is who I am individually. And that is, quite frankly, the mission of our agency. We have taken a stance to say it like it is and make sure there is action behind it. For some, that is quite a bit more difficult, but for us, it's a matter sometimes of making sure we know where the right side of things are. And so at one point or another, I'll tell you, I used to have some board members that would say, you know, if we said this or if we spoke out about that, it may affect our funders, it may affect donors. We don't think about that now. We really don't. And I'm not saying that from a place of being arrogant, but I do believe in a much higher source. And I believe that, you know, every single thing that our agency needs to do, we will be protected. And so I don't hesitate to say what needs to be said and to push an agenda that really speaks to equity. And it's kind of nice to not have to walk in a room and change who I am and what I believe as a result of trying to offend people. So.
Fantastic answer. Thank you so much, Lisa. Erin, I'm going to transition right to you because of what Lisa just said of she does not think about, you know, offending funders anymore. And you and I work for the public library system, one of the most democratic of all institutions. And we often, Erin, our institution came from always a place of neutrality because, you know, we were Switzerland, right? Military neutrality, because we were afraid of offending funders. And in recent years and more recent years, especially since you have joined the library, we're seeing papers, white papers, we're seeing stances, one just recently where the American Library Association took a stance on white supremacy and fascism, saying that it was antithetical to library work. We're seeing bold stances. This bespeaks leadership. Tell me about, Erin, and I just use the shamelessly, Angie, I use the public library as, you know, a transition here, but I really was struck by what Lisa said, that she really is going after strategic priorities, vision, goals, and what her heart is saying, as opposed to worrying so much about the funders. Tell me, can you expand on that just a little bit more, Erin?
Yeah, absolutely. You know, despite there not being a whole lot of literature out there about the intersectionality of racism and sexism, and specifically in leadership, and how that impacts leadership, the reality is, specifically for women of color, leadership, networking, and advocacy looks dramatically different for us. It requires us to speak up, to claim our space, for a seat at the table, or claiming a whole table all in itself, in order to claim our positions of power and to be able to advance into leadership. So our mere existence to come into a space where we were never invited or intended to be pushes for systemic change. So specifically for women of color, we don't have a choice. And I don't think it should be a choice for anyone. We shouldn't have to choose between our desire to be an individual making good actions to be a leader, or our desire to push systemic change. They're one and the same. And that's the great thing that I love about the library. Yes, we've been Switzerland. Yes, we've been neutral for so long, but the reality is, at the core of who we are, we want to be inclusive. We want everyone to know that they belong in our space and that they're welcomed. And that's at the heart of what true leadership is. It's not about us garnering power for just us as an individual, but it's the collective upliftment of everyone. And the reality is, if you're a good leader, you're making everyone better. And that's the inherent aspect of systemic change.
Angie, where did you find these women? They are amazing. They are just amazing. I am so uplifted this morning. I really am. What a great day to kick off Women's History Month. Thank you so much for those words. I want to move on to Doni and still stay on the leadership topic, but I'm worried that there are women who are not like the beautiful faces I see in my Brady Bunch boxes here. I'm dating myself. Who are not necessarily like the panelists, like most of us on this screen, who are not in formal, at least, leadership positions. How can they create change? Do you have any words of wisdom, Doni? You're on mute, Doni.
I'm sorry. I don't know that I would call them words of wisdom, but I do have some thoughts, and it's really about courage. I think one of the things that we are experiencing now that's a really great thing is that people are more willing to own themselves, to do themselves, to be themselves. It's like Lisa said, it's, she works in an environment where she doesn't really have to choose. She gets to be proud of who she is and proud of her own predilections, and she pulls those things into her work. And I would encourage us all just to be brave, to, if you see a place where change needs to happen, that you step up and you talk about that change needing to happen. And you can start that. I mean, we are teaching my 5-year-old granddaughter to say when she doesn't think something is right. And I think that you have to be brave, and you have to also be able to rely on people having your back just a little bit, because it can be pretty scary to step out and say, this needs to change. But at the end of the day, if you're not doing that as somebody, you can do that from whatever space you occupy. And if you do that, then people start to pay attention. It is, and little things can cause you to decide that this is enough and you're not going to take it anymore. And you should capitalize on whatever that impetus is in your life, and raise your voice, bring voice to the issue that needs the change. And ultimately, especially in a city like Toledo, where it's pretty easy to get your voice out there and get your voice heard. I mean, if you lived in some place like Chicago, you'd have a bigger struggle, or in New York. But in Toledo, we have access to our elected officials. We have access to our political parties. We have access to people who have access to things that maybe we don't. And it gives us an opportunity to really start to talk about change. And so I would encourage anybody. I so enjoy what I see happening at the university around the Black Student Union and other groups of students who are really starting to understand that their voices have import. They hearing what they say is important to change. And that's, I think, a really simple way to go about it. Just don't be afraid. Somebody will hear you, and somebody will support you in that conversation.
Thank you so very much, Doni. That is very profound. Deb and Reem, also looking at meaningful change. That's one of the words that Doni mentioned. And oftentimes we are always talking. We're talking about things, but there's no action that follows up. For Reem and Deb, what does it really take to create meaningful change for women and girls in Toledo? Are there specific actions that attendees today can take away and create a more desirable community for women and girls specifically. Reem, Deb?
I'm happy to jump in. I think that you talked about the voice, and it took me almost my entire career to find that, to be at this point. There are times I remember last summer just crying, sitting in my backyard crying, thinking that I should have said something multiple different times, but that I felt weak because I was the caregiver, you know, I'm the financial provider for my family in a sense, you know, and I had to choose between biting my tongue or feeding my family, right? You know, it gets to those things. And so you do that self-reflection, and it takes a long time, I think. So I see a lot of people that might be early in their career. I don't think the first day you're at a job, you march in and demand something. It's hard to do that. And I know people do it, but that never worked for me. And so I think it does take mentorship. There's women on the call that have been, whether it's informal or formal mentorship, you've learned from them. And Rhonda, your mom has been one of the forces in my life that had a gentle hand on my shoulder. She's just a class act, and her way of getting things done, she was, you know, she's just a trailblazer. And I always regret that I don't stay in touch with her anymore, but there are people in your life at different points for those things. And, you know, I had a professor at the University of Toledo. He was an African-American male, and in my graduate program, he was my biggest supporter and champion. I mean, he came to my graduation party, and he was there for me at that time in my life. So I think that finding your voice takes a little bit of time and strategic, you know, I used to just say things, and it would get me in trouble. So being a little bit more strategic with your voice, and what is it you really want to do? Like, it's great to say we want world peace, but what can I and what can the moment I'm in really make some kind of effort towards that big goal I might want, which is world peace. So it's more like strategic, and what is not negotiable for you? You know, what are things that you just won't give in on, you know, you won't compromise, whatever it is. And then there's other things like, it would be great if we could do this and do that. But I think that, yeah, it has to be a little bit more strategic, and mentorship. There's a lot of women on this call that are available to people, and I'm always willing to do those kind of things. I think that sometimes though we get a little tired being the only, you know, Latina CEO in the area. You know, that's disappointing, and it's a little exhausting because everybody wants you to do something because they usually need diversity. You know, it's not because of my skill set or other things. It's like, oh, well, we need to click this box. That gets a little, you got to figure out when you're being used. And if you can be used in a way that's strategic to benefit you and what you want to do. I just remember someone, he was African-American, and he said something so profound to me. He said, you know, for so long, I thought I was a part of this family of politics and whatnot. And he said, no, I was the help. And it hurt him because he really felt like he was a part of the family, and he wasn't. And so as long as you know that going into it, but I think leadership, it doesn't always have to be a female. There are tons of different people that can help you through that moment in time. And so it doesn't happen overnight. And through our sanctuary training, we do some, how did you handle things? And I realized it was really my mom who, someone called her a dirty Mexican, and my mom showed her who was dirty afterwards. And I found out that was my first instinct, was to fight all the time because that's who my mom was. And she taught me that. Not everybody has that kind of mom that's going to show people something. And so women are, you know, we handle things differently, and that's okay, but find what works for you and seek out mentorship.
Wow.
I love your mention of mentorship. Mentorship is so very important. I remember for several years, I attended so many trainings on privilege. And then I learned this one definition that stuck with me forever, which is that privilege is the opportunity for more opportunities. So I would say we all have privilege in one way or another. Some of us have ability privilege, some of us have skin color privilege, some of us have language privilege, and some of us have access and political knowledge privilege. So find your privilege and extend it to others. Make that opportunity for more opportunities available to more women, whether that's by supporting a woman who's running for office, supporting a small business, building affordable homes because Ohio and Toledo has a very limited supply of safe and affordable homes. All of these are ways that we can all engage in. And I know so many of you who have engaged in so many of these supportive mechanisms.
Thank you to Deb and to Reem. Deb, those personal stories really hit home for a lot of us. They were very heartfelt. Thank you also for mentioning my role model as well, Ms. Billy Johnson. I often apologize to her that I am her only daughter, only child. And she says, no, I wouldn't have it any other way, but she's been really amazing. And one day, Deb, you and I and my mom will have to talk about some of those horrific stories that your mom faced that my mom encountered as well. And I was sitting right there and looking at how she handled those situations. And you didn't hear it from me, but we often call her in the family Billy Badass. So that gentle giant that you see that's mentoring and very like the queen of diplomacy, there is another side to her. And I'm so glad I've got to witness that other side like your mother did, and encountering such a negative experience. And we'll have to sit down offline and talk about some of those things, but she taught me a lot. Reem, thank you so much for what you were saying as well. This panel has just taught me so much. I'm getting teary. You might see me wiping my eyes, but it is really emotional for me because some of the experiences the panel has discussed, I've experienced throughout my life's journey as well. And I'm sure that the attendees here have experienced them as well. We'll take just a few more questions before I turn it over to Wendy. But one of the things that we talked about a little bit earlier, there are so many intersections, and you've all brought it up, between race and sex. Many of you talked about the inequities that are experienced by women of color. And I want to just really dissect that just a little bit more. How do you as panelists look at that whole, like, raising awareness of sexism in conversations about race and vice versa, like creating social changes, raising awareness of racism in conversations about gender? It can be pretty tricky to do that. So please, any of the panelists, do you have any words that you'd like to share about that intersection?
Okay, I'll go again. I've been trying not to go first each time. But for me, they come together. Again, it is very much a part of the mission of our agency. And in many instances, because it's impossible to separate it in terms of how we see the need of the world, it's important for me to be able to speak as fluently about issues of gender injustice as it is for racial injustice. And so in doing so, I think I'll go back to the presentation that United Way did. You know, the story is there in the data, and the data doesn't lie. you can't really manipulate it unless you're not following it so succinctly yourself. And so the fact of the matter is, there are so many disparities that women face overall, but when you begin to even dive deep, the women of color are also amongst the gender have even greater degrees of disparity. And so when you see us coming, we're coming really on that platform. And for us, it is all about equity and pushing that action. You know, the other thing I want to say, and I've heard a couple of the other panelists really mention courage and being very bold on what it is you want and really articulating that. But I want to pivot for just 1 second and pick up on something that Deb, and I think even Doni in her earlier comments talked about, and that's really the leadership in understanding when you shouldn't go it alone. There are so many women. Deb mentioned Billy Johnson. Billy Johnson was my mentor, still is. And there are, I think, a need in particular for younger women to understand that that is not a weakness, to reach out and to touch someone that has maybe come before them. And it is also not a weakness to accept coaching, because it is a scary world out here. And we really didn't get where we are by being nice. But the backlash of speaking up and being too aggressive gets you coined in many different respects of being aggressive and angry and, you know, emotional and, you know, all of those types of things. Sometimes there are women, again, that have walked the path that can give you all types of tidbits to help you all along the way with that journey. And so while it may be true that there are so many issues that intersect with gender inequity based on race, there are many people, men and women, because there are allies across the other side that are there to see that women are being promoted. And so I want to just underscore really the importance of reaching across that aisle and making sure we are relying on coaches and mentors to help us in this space as well.
So well said. Any other panelists on that intersection between race and gender?
Yeah, Lisa, I think you're a great starter. So thanks for doing that. To follow up, Lisa's absolutely correct. The population is so similar, and the work that we do that advances racial equities is also part and parcel of work that we do to advance women's rights. Today is Women's History Month, and it's only befitting that it follows Black History Month, because if we look back at history, we find that the women's liberation movement was inspired and was made possible by the civil rights movement.
That's right.
It was through the civil rights movement that established the protest culture and the systems and social structures that allowed women to come together and seek change. Women were part of and leaders in the civil rights movement. And when they were once they started that, they realized, okay, well, now we can focus on women's rights. And they started with the women's suffrage and the women's liberation movement. So we can't forget all of the different community groups. And Doni did a great job of listing so many different facets and so many different identities that women identify with, that we should continue to keep at the center of our work. So, I mean, we have to continue to remember women, but as a housing attorney, for example, we don't only represent women, but it just so happens that all of the women that I've represented over the past month have been, all of the persons facing evictions over the past month have been women, and they've been Black women. Unfortunately, that's because the brunt of evictions is falling upon Black women in our community. So coming here together, all of us, talking about solutions and working toward a better future is how we can address those intersectionality problems.
Thank you so much, Reem. Any other panelists before I move on? We have about 10 more minutes.
You know, in terms of HRC, we truly believe it's our social responsibility to engage the community in these critical conversations. And I know several other organizations feel that same responsibility to the community. We set out at the top of the year to have the intention to have a different kind of dialogue with the community. We wanted to be able to identify opposing views, confront gaps, and really to be humble and brave enough to work through conflict, because we feel like that's where change begins. So I'm hoping many of you had the opportunity to participate in the virtual Unity Day celebration honoring Dr. King. We were extremely intentional in our selection of Austin Channing Brown. She's the author of I'm Still Here, Black Dignity in a World Made for Whiteness. If you haven't read it, read it. Shameless plug to TLCPL. We have audiobooks as well as hard copies for you to check out. But she is the perfect example of that discussion of where race and gender intersect and why it must be talked about. You cannot have one without the other. The advancement of both are necessary for us to truly challenge systemic change. I'm so happy that we were able to extend that conversation by partnering with Lisa at the YWCA, with Nina at the Women of Toledo, as well as the University of Toledo and the library, to have community book discussions and also provide discussion guides, because we wanted families, friends, colleagues to continue this critical conversation. It's so important that we don't stop talking. It's not just about celebrating 1 month, Black History Month, Women's History Month, one day in terms of MLK. We have to continue to talk these things through to be able to identify how we need to push the needle in everything that we do. I'm so happy to see the work that Lisa is doing. Dialogue for Change is exactly this. It's providing the community with tools to be able to facilitate conversations about how we are, why we are, and how we move forward collectively to be better. So we can't stop talking. We can't talk about one without talking about the other. It's just what we need to do in order for us all to be collectively improving and growing and really making our community better.
Thank you so much for that, Erin. And thank you, Lisa. I registered for the 21-day challenge, and our leadership team has all been encouraged to sign up for the 21-day challenge. I encourage you to do so. Starts today, actually March 1st. So again, Angie, we're full of shameless plugs here, but these are things that women who are attending really want to know about. I think I'm going to pose this final question as we begin to wrap up. I'm going to, if someone can put that for Asha, the 21-day challenge in the chat, and also Erin, Austin Channing Brown's website, possibly, that would be great. I want Doni, if you will, to, I love ending on high notes, and before I pass it on to Wendy and then eventually thank everyone for this dynamic panel. Tell me, Doni, is there a way that we can make the Toledo area a desirable place for women and girls? And is there evidence of some of those positive things that make Toledo a special place for women and girls? Do you see that now? I know there's a lot of work to do, but I'm trying, Doni, to end on this positive note. I know that I've raised my daughters, my adult daughter, twin daughters, in the community, and there has been many positive things that they have taken advantage of in this community, and so I want you to touch on the positives.
Okay, so before I touch on the positives, and I think this is a positive statement too, and it goes a little bit back to gender and race. I think one of the things that women should always keep in mind is that nobody gives up their power easily. They don't. And if we have to recognize, I think, as women, and especially Black women, that when we are entering into that discussion about finding our place and building our tables and using our voices, we are talking about, just by the mere fact that we do that, we are talking about displacing power, changing the way the dynamics of power in the community work. And so you're going to get called names. I cannot tell you some of the things I've heard about me along the way. Some of it's true, but some of it's not. Just because of the way I present or the challenges that I choose to take on. But all of us on this call, all of us who are participating in this call, have been in the same situation. If you are Black, though, you get called the B word a whole lot more than anybody else if you are smart and if you are articulate, and if you choose to demand that your voice be heard. And it's really important that we learn to brush that off and keep moving forward, because it's going to happen simply because, again, when you start to move the pieces of power around and you start to claim your own, people will push back. They will push back. The positive things about that, though, in this town are that if you are patient, and if you just really take a look at who is in the room, generally you will find somebody who is rubbing your back. It's easy. It's not always easy, but you will find women who are embracing you. We've talked a lot about Billy this morning. I was gonna hold my comments to myself because I am another one that adores her and kind of like keeping that to myself a little bit. But you will find people like Billy, or you'll find people like Lisa or Rhonda, women out there who easily support and embrace, but we don't find it quite enough, and we have to work at it, but it's there. And there are people in this town, because of the size of the town. You meet new people like Erin. I can't wait to have lunch with you, Erin, and find out more about who you are. And we can build our circles, is what I'm trying to say, in this town. We can find ways to support each other in this town that are more difficult in other places. We have the Everly Center that is really reaching out into the communities, and we have a phenomenal group of sororities in this town who honor women every single day. I mean, so there's lots of great stuff going on in this town. The mayor has a predominantly female leadership team. How about that? We have a significant number of females who are in elected office. How about that? I mean, that goes to show you that we are finding our way in this community when it comes to women. We are getting done what other cities are still trying to get done. But the fight is not over, and the minute we relax is the minute we start to lose this momentum that we have. So, and I agree with so much of what Deb and I have known each other probably longer than we want to talk about, because then you know how old we really are. But I've watched Deb, and I've watched her be the only one so many times and handle that with such dignity and such grace, and still be embracing of other women that surround her. So I think that's a really cool thing. I think that's a great thing about this town.
Doni, so well said. Thank you so very much. And Angie, I know you would be proud that we are right on time. I'm going to turn it over to Wendy before we thank the panel, give them maybe a final thought or two. But it has been just an honor and a privilege to serve as moderator today. Wendy, I'll turn it over to you now.
Thank you so much, Rhonda, and thank you to the panel. And I was asked to sort of look at the comments that were made and a little bit of a summary of some of the thinking. And then, again, would like to work with everybody here about some of the go forward after talking about this energy and what everybody has to offer. My background, I was a nurse, then I was a public school teacher, then I went to law school. My first job out of law school was with the AFL-CIO. I went from a world where I worked with nothing but women and women in leadership, pretty much in nursing and teaching, to a world where I was often the only woman in the room doing a lot of fundraising with very powerful people. And I would have days on end where I didn't even see another woman. I didn't see people of color. I lived in cities, though, where people who were women and people of color were CEOs of multinational corporations. I think that in Toledo, you have an interesting situation here where that dynamic is not necessarily the case like it is in, say, Washington, D.C., or I was in Richmond or Houston, different places. So I think there's a unique challenge in Toledo to go there, because when I look across the screen, I see a bunch of CEOs for nonprofits. I see the nonprofit warriors and the people who lead this community to better health and a better education. So that being said, this conversation, you know, we got to figure out how to be very strategic. I think some of the points that were made, I like the notion of sensitivity to weathering. And I think right now there's a dynamic around that where it might be understood more than ever. And again, leveraging sort of what the pain of the last year has brought folks. I liked Lisa's comment on that and the way others, you know, talked about that. I think the point, make the table, Doni, you're right, make the table. But then I am a big believer in put your elbows out and get at those other tables too. That's the Texan in me. You know, I think women in Texas are taught you got to do that or you're never getting there. So, you know, it's kind of, you know, try a little bit of both. Use your data as your guide. I think that, you know, Asha made that point. Lisa backed it up. It's like, you know, it is your evidentiary basis for being there. I see Ashley Futrell's joined us as a lawyer. She knows evidence is everything. So, you know, I think keeping that in mind when you are moving to the table. I think, Deb, you know, what you said about flexibility and being good to each other and listening to each other. And I think that we should all do that when we talk about getting to the table. Really listening to, you know, it's funny because the problem comes from generations of stuff and working through it. So try to listen to each other a little better. Take that time. You all know what it feels like, but try and teach somebody else a little bit about that, especially men, and talking to the men closest to you. I think when you are not empowered, you don't get to move into a table as easily. I think for those folks to open conversation and dialogue and listen to each other can maybe be helpful and help them understand, and then they lead to helping someone else understand. And demanding opportunity. I think when Reem was talking about that, you know, how, and then sharing it with others, really taking your points of leadership, your opportunities, and sharing them and making it available to others is key. And I think doing that through mentoring. I also want to remind folks, love mentoring. I've, you know, had great mentors. I've had great mentors who were men, you know, and really taught me a lot as well as women. And make your mentors multi-generational. On this call, I got Lucas as my younger mentor. Lucas teaches me a lot about the world. Really look to that sort of 360 in your life, because you have knowledge to impart, but we have a lot of younger people we can learn from. And they're not just there for tech support, is always my joke. They're actually really good, smart, thoughtful people. And if we don't all see it a little differently, I think we sort of, you know, close ourselves off from a better conversation. And then I think, you know, I think that all of you talk about destigmatizing so much of what we do, and let's do it with each other to start with. Looking introspectively, the conversations you bring people into, your workplace, your leadership style, is it open to people getting help? Is it open to being understanding about their time with family or their parents? You know, whatever that looks like, really, really dive in on that. And then there was a comment about funders, and because, you know, after the last 20 years of nonprofit, and I have, Lisa, man, all of you who have ever tried to raise a dime from some folks, it is hard. It is very, very hard. And I work for 100, what is it? You know, the United Way is like this big old battleship, over 100 years old, the ultimate good old boy network. There is nothing quite like it. And so spending time thinking, well, is this going to make somebody mad? I don't want to, you know, and then, you know, we keep talking about have to communicate, help your funders find the path, help them see the light, bring it to them, almost like every day, a little something that helps bring them into the organization and understand the needs in our community, especially the needs of women and children. It is incumbent on all of us, no matter what your role is, to really bring these folks in and to not feel like it's insurmountable, because I think that can be easy to do. it's hard. And I guess these are the sort of takeaways from the conversation today that I'm hoping encapsulate what we're working towards. And then I'd like to work with the United Way, work with the Eberly Center, especially with our, our fine folks in our data analytics shop, our policy shop, with all the partners on this call. All of you are great leaders in your own discussion and experience, and see as a call to action how we can sort of focus in and take some next steps that are strategic and evidence-based and can make a change in community. We know of others who have done some good work in this place, but I think this is the day that we can really get maybe a little more organized than we have been previously. Working with electeds is key. That is such an important point, Doni. They really hold a lot of the discussion, and we do have a lot of women. I believe, Dr. Fitzpatrick, if I'm not mistaken, like Matriots, you've spoken with them, and the Matriots organization that sees to it more women are elected to office in Ohio and are better funded as candidates. And that is a bipartisan effort. It's just good female candidates that have been well vetted and funded. So, it's like looking at these streams of opportunity, I think, critically, and where you can find your place in it and your voice. And we are open to looking at how we move forward and having check-ins and conversations. We will share out of United Way data points that might be helpful to you. See us as a resource at United Way, the team here, the Eberly Center, obviously, and all the other partners on this call, because that's how we'll get there. And I want to thank you for the time. You're all very talented, beautiful people. I too am in the Billy Johnson fan club. First time I ever saw that lovely lady, it was in Ann Arbor. I didn't know who she was. I didn't live in Toledo. And I liked the control she had over her husband in particular. He was getting her things and taking really good care of her at a restaurant. And I thought, I like her style. And then got to know her as a professional. And she's 1,000 times more impressive as a professional and a leader. So, just looking forward to how today progresses and how we can, after we follow up, send you some things and work together and petition a conversation, with folks here in town, our leaders, and through United Way and some of our folks, just get us where we need to be, because it's time to take what has happened this last year and really make it work for us, make crisis into something creative and thoughtful and wonderful for our community. It seems like a terrible place to be, but it's time to do it. So that's sort of our position on it, and looking forward to everybody being together again in person to have this talk. So thank you for your time. Reach out, and we love you. We'll take care of you, and we'll go get them.
Wendy, thank you so much. And I have to just quickly say before the 11 a.m. session that if anyone has ever met Wendy's beautiful mother, then you know where she gets it from. So thank you so much for wrapping up and summarizing this amazing discussion. For the panelists, your words have been epic. I think of the quotes. I'm a quote person. I'm a literary person. So, excuse me, I'm thinking of Gloria Naylor, the author who wrote The Women of Brewster Place. She once said that the greatest power you know is the power you possess, and to be militant about the validity of your story or your truth. And each of you as panelists have been militant today about the validity of your stories. They have all made us wiser and better for it. So I thank you and I call your name. Lisa McDuffie, I thank you and call your name. Erin Baker, I thank you and call your name. Deb Flores, and I thank you and call your name. Reem, Subei, I thank you and call your name to all of you on this panel. It has been a pleasure and an honor serving as moderator. Angie, I know you want to give people a little bit of time to break before the next session, but I want to thank you again, Angie Fitzpatrick, Dr. Fitzpatrick, for you and your team in coordinating this amazing, amazing summit and kicking it off on Women's History Month. Thank you so much to all.
Wow. Yeah, let's give them all the big, Zoom applause. Thank you so much, everyone. We had the right women in the room this morning. This was great. And there's some women who aren't here, right? So like I said, this is the beginning, not the end. We will keep these convos going. Next up, we have multiple panels meeting at the same time to dig a little bit deeper into the issues. So we have a public service panel. We have a panel on women's health, on women in education, on women in business. So we will be moving into those panels. We have had, of course, we're really sensitive to Zoom bombing. If y'all are familiar with this phenomenon, you know, you do not want to get Zoom bombed. So we put on a bunch of security features, and that is stumping some of our panelists. So we need to just pause for a minute and make sure that everybody can be with us. So we're gonna probably start our 11 o'clock session at 11:05. So, you know, take this opportunity to get up, stretch, use the restroom, look at something other than a screen. And when you come back, we will move you into breakout sessions. So moderators, if you're here, that means feel free to take another 5 minutes into lunch. If people have to leave at noon, they have to leave. But, you know, somebody had been talking earlier today about scarcity. Forget about scarcity. You know, there's abundance. Time is a little more abundant than we think, right? So we'll give ourselves another 5 minutes. All right. Thank you all. Hang with us.